Hello, good evening.
Welcome, Prof. Welcome, sir.
Good evening, sir. Welcome, sir.
Good
Prof.
evening. Yeah, good evening. Sorry for keeping you
Good
waiting.
evening, sir. Welcome,
Good
sir.
evening.
Good evening,
Yes.
welcome, sir.
Good
Yeah.
evening, Prof.
Good day,
Good
sir.
evening. Yeah. Good evening. Okay. So today we'll continue with health education. That is the other part of the course. The other part of the course. Health education is a tool that public health practitioners enjoy using. At the beginning of public health started with a law. Public health started with a law, with the appointment of the medical officer of health. And the medical officer of health was operating with the public health law. And when the medical officer of health recruited and trained the environmental health officers, they were given the law and they went about door to door reading the law to people, telling them they have committed a crime for keeping for creating an insanitary condition, for creating insanitary conditions. But as it is usually said, it is said that the police are not usually the friends of police. No matter how the police will tell you that they are friends, we don't see them as friends, especially because we have changed the modus operandi of how the law is supposed to be enforced. So when public health started with using the law, and sanitary inspectors were going door to door, they go there, they were supposed to advise people. So when they see any insanitary condition, instead of applying the law, they were supposed to tell people about the disadvantages of living in such an insanitary condition, and then tell them what to do. Okay? It is supposed to be only when they fail to do what they are supposed to do that they will issue what they call the abatement notice. And when abatement notice fails, they will report the matter to the magistrate in the sanitation court. So the magistrate will look at it and then issue another order directing, giving the offender another opportunity to go and clean up the environment. It is only when the offender remains incalcitrant that the full weight of the law will be applied. And that full weight of the law is usually that the environmental health unit will now clean up the environment and then charge the offender, give the bill to the offender, and of course with JARA. Okay? So, but because of that, because of these enforcements, people weren't happy, comfortable with public health officials. They became hostile. Meanwhile, public health officials are supposed to be community-based people. They're supposed to be people that work in the community, people, disciples or followers of Hygia. Hygia was a Greek goddess of prevention, of hygiene. Hygiene has to do with sanitation. Okay, they work in the community. So you cannot be a public health practitioner without being free in the community. And being free in the community, you cannot walk in the community with an armed escort. No, you are supposed to blend in. In fact, when people we go for community-based activities, we just go and then we do community entry. You just go visit the traditional ruler, and usually they will bring alcoholic drink. So even if you're working with the companies that ban the drinking of alcohol during official hours, that doesn't apply. Usually doesn't apply. You can take a little to relate very well with the community, members of the community. So that is why health education. That's why right now in public health, we emphasize health education. Health education. And health education is of various types. Health education is not like moving stuff. It's not moving stuff. It's not giving lecture like we are doing now. It has different components. And health education can even be a drug, can even be like a drug used in the treatment. Used in the treatment. It can also be used. Usually it is the first thing that is available when a new disease comes up. Like when HIV came in the early 80s, there was no drug. The only control against HIV was the message. What they said, the ABC method: abstinence, be faithful, and condom use. And that was enough. That was actually enough to reduce the transmission of HIV before the drugs came up. And of course, even during the COVID-19, before the vaccines came up, health education was used to ensure physical distancing and social distancing, telling people not to visit elderly ones, especially, and people that are sick, because their body is so weak, and their body is weak, and if they are infected with COVID-19, it becomes deadly. Okay, so health education is used in controlling those diseases. And of course, in diseases like diabetes, the best treatment to give to a diabetic patient is actually when you teach the diabetic patient what to do, when to do it, and how to do it. Because the diabetic patient is responsible for providing more than 95% of the healthcare required by diabetic patients. Okay, so the best option is not to rely on the health workers, but rather to teach diabetic patients what to do, how to manage their disease. So that is why health education is very, 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 very important. And we have a lot of them. We have they have different types, and we are going to look at them in these lectures. The first one is health education on healthy practices and lifestyle. The second one is patient self-management education. The third one is behavioral change communication. The fourth one is risk communication. The fifth one is social marketing. The sixth one, community mobilization. And then we have advocacy. We are going to look at them, not in depth, but we are going to mention them so that you have some idea of what they are and how they can be used in public health. Okay, so the first one is education on healthy practices and lifestyle. At times they say that at times we tell you to do CAP studies. CAP studies standing for knowledge, attitude, and practice. Because you cannot practice a good a good, you cannot have a healthy practice without knowing something about that practice or the reason why you are carrying it, why you should practice it. And then if with good knowledge, your attitude towards adopting that practice will change, and then finally you will decide you will take up that practice. So this type of health education tries to empower members of the community with the knowledge and information needed to promote and maintain health. Remember we told you about female education, and that female education is actually tied with the woman knowing what to do, because the woman is actually the head worker, or the nurse or the doctor of the household. If any member of the household gets sick, it is actually the woman, the mother of the house, that takes responsibility. And it is good. It's always good to know, for the woman to know what to do and how to do it, and when to do it. So if a woman that is knowledgeable will know that it is if a child has a fever, and she gives paracetamol, if the symptom persists, they will need to either see a doctor or do other things. Yeah. So that is why this kind of education, health education, is important. Telling people what to do. And the importance of this form of education is even recognized in the Ama-Ata Declaration. Ama-Ata Declaration. I just hope that you have seen this declaration. If you haven't seen it, please Google it and find out. The first of what is considered essential healthcare. What should be available in every health facility are listed, and they are called essential healthcare. The first of essential healthcare, the first to be listed, is education concerning prevailing health problems and the methods of preventing them. So this is the first of the 8 components of primary healthcare that must be available to every member of the community at all times. So the responsibility of health workers to provide this kind, to regularly teach, inform people about health information. Yes, health information about things, prevailing things. If anything happens, the health workers should be the one providing the information. If there is suits, the health workers should be one, or the public health or practitioners should be one providing it. If you have flooding, the health workers should be there telling people what to do to prevent harm. If there is heat stroke especially in these temperate region, they are beginning to suffer heat problems, heat waves. It is the health workers or public health officials that will tell them what to do to avoid getting into trouble. So that is the thing. This is the type. It is very, very important, and it is recommended to everyone, especially if you are a public health practitioner. Okay. The other one, okay, so it also persists. It is not just, we have to also say that health education is not just what is practiced in primary healthcare centers. It is done all over, all the tiers, all the levels of healthcare. So it is not what is done in primary healthcare centers. So in primary healthcare centers, remember that primary healthcare centers, they are beyond medical care. They go beyond the treatment of patients. They include even proper nutrition and so forth. So at the general hospital level or secondary prevention, they talk about medication. So if you give somebody drug, you have to tell the person what to do, how to take the drug, the dose, the side effects of taking the drug, and what to do in case of an overdose. Because some persons will think that for mild headache, you take 2 tablets of paracetamol. For severe headache, you take 4. Some people may think like that. And if they do, they can run into trouble because paracetamol, though is so common, but if you take overdose, that thing will kill you because it will just destroy the liver. So medication education is important, and even up to healthy eating, what to eat, balanced diet, we have to, and a lot of all those things. And then at the tertiary level, we have to, of course, if somebody has developed complications, we have to also tell the person what to do, how to do it, to live a normal life. Okay, so the other one, and then some, yes. The other one is, the next one is self-management education. So if somebody has a disease, especially chronic diseases, chronic diseases are treatable, but they are not curable, which means that the patient with a chronic disease, the only way the patient can live a long, healthy life, a long and healthy life, is when the patient knows what to do, how to do it, and when to do it. And it is very, very important for diseases like diabetes, like hypertension, like sickle cell disease. You must teach the patient. The patient must be trained, must be enrolled into a patient self-management education program. In fact, in the developed countries, every newly diagnosed diabetic patient is referred to a diabetic self-management education program. And in fact, the International Diabetes Federation, they believe that any diabetic patient that hasn't gone through the diabetic self-management education program is actually receiving a substandard care. But in Nigeria, we tend to hide information from patients because we want the patient to be completely dependent on us. It is criminal. It is criminal because it shouldn't be. It shouldn't be, especially for a person with chronic diseases like diabetes. In case of diabetes, more than 95% or up to 95% of the care is provided by the patient himself. So the patient cannot depend on the health worker. You must teach the patient. In fact, that is what we have to probably begin to advocate in Nigeria. We begin to advocate in Nigeria that we should begin to have diabetic self-management education programs. And I think it's one of those short courses we are also trying to mount in our program, such that somebody can decide to open a diabetic self-management education program, get clients, and then become even self-employed. Okay, sorry. So that is also important. So this diabetic and self-management training programs are important, and it should be widely available. I know that it's not widely available in Nigeria, but at least we can start. So if you finish this year program and and possibly attend our diabetic self-management education course, you can use it. You can start it. You can start. You can even do it online, so that your clientele will be as big as that of the School of Public Health. Okay, so this diabetic self-management education program, yes, we have talked about this. Very, very important, very, very important, and we should be able to do it. To teach the patient, they are given the knowledge and the skills, and they are given how to understand, anticipate, and manage the problem associated with the disease in order to prevent the complications. In fact, it is a diabetic self-management education program. It's not like the health talk. It's not health talk. It is packaged. It is packaged and packaged in such a way that is able to deliver competence. It's competency-based, which means that it is not just theory, but the patient should be able to do something. So some of the models include the first week, you teach them about diabetes. The second week, you can teach them about the use of diet in the management of diabetes. This is very, very important because diabetic patients in Nigeria, anyway, I think it has to do with lack of knowledge. They are told to eat unripe plantain and beans. If you tell me to eat those food for life, I don't know. You will make my life miserable. So you have to teach them. You have to teach them. And there are also certain misconceptions. In fact, I've even heard from the so-called dietitians where they say, sugar is harmful. No. Yes, all certain foods are harmful. No, it's not. In fact, one of the criterion for a good diabetic diet is that the person should be able to, you shouldn't deprive the diabetic the joy of eating. You shouldn't. So instead, you can make the staple foods better. You can make the staple foods better. So the other one, the third week should be physical activity. For physical activity, at times can be as effective as drugs in controlling the blood sugar level, especially as there are no overdoses. There are no overdoses, especially if your heart can carry. If your heart can carry physical activity. Physical activity, if you carry out physical activity, it remains active for up to two days. So it's very, very good. Then you can teach them how to use drugs, not only how to administer the drugs, but even how to source the drugs, sourcing the drug, because we have a lot of fake drugs. So how to source the drug, you have to tell them. You have to also, even how to store the drugs. We have problem with drug storage in Nigeria. We have problems with drug storage in Nigeria because even people that sell drugs in the market, they just showcase, I think that's what they call it, showcase the drugs and the sun and everything will just remove any potency from the drug. Okay, the fifth week is to prevent and manage complications of diabetes, and then the sixth week can be spent with dealing with the social and psychological problems of diabetes. So all those things can. In fact, some of us are also trying to look at how to, if you combine religion and such, health education infused with religion can be wonderful. In fact, I have been thinking about it. What of daily devotional? Daily devotional. You can bring in all this information and put them in a daily devotional. And I'm sure that a lot of Christians will find it significantly easier because it is not a diabetic patient fights a battle. And that battle can be, should I say spiritual? They can be low. They may be low periods, and you need to psych them up. You need to psych them up. So diabetic self-management education is very, very important. In fact, much, much important than having a consultant endocrinologist managing you. Because the patient actually does most of the care, provides most of the care. So the patient must know what to do, when to do them, and how to do them. Okay, okay. Okay, so still on this, yeah, there are also structures. In fact, international, okay, I've talked about that. Yes, I've talked about that. And it is also interesting. It's interesting what kills Nigerian patients. What kills Nigerian patients? Look at this study carried out. I think it was this study was carried out by our colleagues in FMC Umuahia. In fact, I know Onyunoro, Onyunoro, and I also know Kebu because they trained in Uniports. So we are contemporaries in medical school. Look at the pattern. This is the pattern of diabetic mortality in a tertiary health facility in southeastern Nigeria. Look at the reason. What all these ones are called the acute complications. Acute complications, meaning that the diabetic patients, the diabetic patient, they didn't know how to manage their blood sugar level. They didn't know. And that was what killed them. They didn't know because they weren't trained. They didn't know because they weren't trained. And so which means that we need to change the whole diabetic management of diabetes in Nigeria. And the best way to do that is to institutionalize dietary self-management education. Okay, then look at this study was carried out in Brazil, and they did a review, a 10-year review, 20-year review of mortality, and they said it was reviewed that the introduction of chronic care model. Chronic care model relies a lot on diabetic self-management, and better access to insulin resulted in 70% decrease in mortality due to acute complications of diabetes in Brazil. You see, train them how to manage, and they will be able to train them how to manage the acute complications, and they will be able to, the acute complications will not result. And even if when it results, they will know how to manage it. They will know how to manage it and not get into severe condition, severe state that will require hospitalization. Okay, the prevalence and types of sexual dysfunction amongst men, amongst males with diabetic patients in Nigeria. Okay, look at prevalence of among that was the control group, which means that even the chronic complications, the chronic complications were even significantly higher in Nigerian diabetic patients, and it also boils down to the fact that they actually don't know how to manage their condition. Okay, so we have this. We have talked about education, yes, and we have talked about self-management education. I don't know if there are questions or comments before we go to behavioral change communication. Do we have any question, comments before we go to questions, comments? Okay, so we can move on. We can move on. So the next one is behavioral change communication. Behavioral change communication is a weapon. It's a weapon because it is there are communications that help people to change their unhealthy behavior. There are communications. Yes, it's almost like helping people, making people left-handed persons to learn how to be right-handed. It is difficult. It is difficult, but it is possible. It is difficult, but it's possible. And that is why health education can be can be therapeutic, can be magical. This requires greater skill. It requires greater skill. I'm just going to tell you. We are not going to go into details because this is this type of skills we want those in our health promotion and communication program to have. So they should have, yes. So what we are going to tell you tell you some of the principles behind how to make people change their behavior. So the behavioral change communication recognizes the complex contributions of social and environmental factors, so lifestyle and ill health, and tries to figure out how best to get an individual to a desired behavior. Okay? So to achieve this, the health educator considers himself as consider the individual as knowledgeable. So you don't, notice that in the previous time, the health communicator, the person giving the health education, is the one moving stuff, the one providing, is the expert. But in behavioral change communication, you will need to understand the person. You will need to study the person. So the person becomes an object of study. In that case now, the individual is the expert that you have to learn. You have to, first of all, learn about them. You have to, first of all, learn about them. You have to understand their belief and their practices. You have to understand their health-seeking behavior. You have to understand their perception of their own health. At times people talk about self-efficacy. Will you be able to, can you do something by yourself? Or do you believe that you can make a change? Some people don't. Some people believe that God said it, that settles it. Or they use other methods. They pray. They pray for them to stop smoking. Prayer to stop smoking, or going for night vigil, praying for a job. And of course, yes, praying for a job, and the next day you sleep all through. So you must know, so you must understand what they have been doing, so that you'll be able to package a health education program that will make them, that will force them to make a change. So when you understand them, then you can now use behavioral change theories. There are some behavioral change theories that can help you create a convincing health education message. There are several of them, several behavioral change theories, and the most popular ones are the health belief model and the stage of change model. The health belief model and the stage of change model. If we're starting with the health belief model, the health belief model holds that people contemplating behavioral change engage in a cost-benefit analysis. So if you tell somebody to change, to stop smoking, the first thing the person will do is to weigh the advantages and disadvantages of stopping the habit. So you should be able to, if you want to convince him, you should be able to make it known to him that the advantages far outweighs the disadvantages. Okay, so that is what the health belief model is all about. So you have to look at their perceived susceptibility to the disease. You look at their perceived susceptibility to disease. There are certain persons that believe that they are immune, they can't get certain disease. For example, a Christian, a good Christian, a powerful Christian, or a Pentecostal, usually a Pentecostal Christian, can say that cancer is not their portion, which means that they are not, which means that their perceived susceptibility to the disease is zero. They believe that they are not susceptible to the disease, which means that they are not ready to do anything. They won't be they will not be prepared to do anything to stop the disease because they are not susceptible to the disease. Okay, therefore they won't do anything. So if you are for example, if you are talking about cervical cancer to a man, the man will say, I don't get I don't get womb now, I don't get uterus, so I am not susceptible. Okay, so there is no way you can preach to a man to go and do pap smear to prevent cervical cancer that he will accept because he's not susceptible to the disease. Okay, the next one is the severity of the disease. How severe is the disease? How severe is the disease? Severity of the disease is, especially if this disease has complications, that the person is afraid of. Complications the person is afraid of. And in Nigeria, this Bembela, those people that advertise in the roadsides, they understand this. In Nigeria, what if you want to scare a Nigerian man? If you want to scare a Nigerian man, tell him that disease will take away his potency, will make him impotent, and the Nigerian man will do something. The Nigerian man will do something. So that's why they will tell you, if you don't treat your staff, the thing will reduce your manhood, or you don't go, or kick and start, will affect your kick and start. Okay, for the ladies, it has to do with infertility. Yes, that's why you just look at the advertisement of those traditional medicine dealers. They are always talking about infertility in women and impotency in men, and severity of the disease. If you want to scare people, at times it's not death. At times death is far. If you begin to threaten them with death, they will say, one thing can kill a man. Is anybody that will live forever? So you have to look for something that will scare them into taking action. The other one is the efficacy of the action. Efficacy of the action. If you do something, how will it prevent? Are you sure it will prevent the disease you are talking about? If you tell somebody to stop smoking in order to prevent lung cancer, the smoker in Nigeria may be wondering, because he probably wouldn't have seen any smoker that developed lung cancer, because usually cancers are found mostly in the elderly, and even when they die, it may not be obviously seen as smoking related. May not be obviously seen as smoking related, especially as the witches and wizards are still believed to be functioning in our society. I know that during the Port Harcourt blast suit, I lost two senior cousins, and I grew up to know them to be chain smokers. So when you have a place and when you have a situation of severe air pollution, it affects the ability of the lungs to exchange gas, and that puts a lot of pressure on the heart. And so those with already compromised lungs, like chain smokers, a lot of them died. So I know what killed them, but a lot other people don't, because other people don't. So the efficacy of the action has to be obvious, to the person, Then the other one, the inconvenience is likely to be caused by the action. So you have to, when you preach a good behavior, you have to also tell people about the inconveniences. If you tell somebody to stop smoking, you have to also tell the person about the problem with withdrawal, if you are stopping smoking, because if you are dependent on nicotine, once you stop smoking, you begin to have powerful withdrawal symptoms. Okay, and then the likelihood of the person coping with the inconveniences. So you tell them about the withdrawal symptoms, and then tell them what they can do to deal with those inconveniences. So that is for the health belief model. Health belief model. So you have to, first of all, you study the patient or the person you want to, the people you want to carry out the health education for, the behavioral change education, and then you begin to use the behavioral change theories to package the health education program. The first, we have said, this health belief model. Okay. So this is a way of doing that. This is a way. I think we have mentioned all these things in passing. Okay, so the next one is the stages of change model. Stages of change model. It postulates that behavioral change is not a momentary decision, but involves a couple of steps. So if you say when they preach to somebody, and they make an altar call, and people give their life to people give their change, get converted, is actually not as simple as that. It's actually not because of not just only the sermon they had, but because of where they were in the behavioral change, where they were at that moment in time along that stages of behavioral change continuum. Okay, so these changes, according to these stages of change model, says that before we pass through different stages before we finally change our behavior. The first one is the pre-contemplation stage. The second one is contemplation. The third one is preparation. The fourth one, action. And the final one is the maintenance stage. So we usually, although it is said to be, sometimes it's not just linear. It's not just linear. People can jump from one stage to the other. But it's difficult to start with, to move from pre-contemplation to action. Okay, so we are going to go through these various stages. The first one is a pre-contemplation stage. In this stage, people are not aware of the potential hazards or potential risk in the health behavior, and therefore have not considered any change to the behavior. So that pre-contemplation, and this is where people in this stage, you're required to give them the necessary information. And that's why when you do a CAP study, we want you to assess the knowledge of that person. We want to assess the knowledge. If they don't have, okay, at times you just ask them, are you aware of this? And if they say they are not aware, it means that they are completely in the pre-contemplation stage. Or if you use the knowledge questionnaire, you ask them questions and they score poorly, they are still in the pre-contemplation stage. They don't fully know. They don't know the risk of what they are doing. They don't know the risk of what they are doing. The guy, the woman, or the man that was brewing alcohol, he wanted a strong alcohol and he used methanol because he felt that would give a kick. He didn't know that methanol, although methanol is like alcohol, but methanol can cause blindness and severe health effects. So he didn't know. So he's at the pre-contemplation stage. And that is why in public health, when we ask you to do a CAP study, I actually like it because it gives you, it's a public way, it's a public health way of diagnosing a problem, knowing what people know, so that you'll be able to design a proper health education program for them. Okay, so the second stage is contemplation stage, in which the people, they already know, and they already know the problem, and they know the benefits, but they are still seeking information on how to make a change. So they know, but they don't know what to do. They don't know what to do. They know about alcohol being dangerous to health, being dangerous to health, but then they don't know how to do it. Or they know that cigarette smoking is dangerous to health. After all, it is written in the cigarette pack, but they don't know how to make a change. They don't know how to change. So at this stage, so they are in this stage called the contemplation stage. The other one, the next stage is preparing to change. Now they know what to do, and they are getting ready. They are gathering momentum. They are gathering momentum to make that change. They are gathering momentum to make that change. And to make that change, they'll get a shopping list if they want to decide to be more physically active. They will say, okay, for me to be physically active, I need a sneakers. I need sneakers. I need joggers. I need so and so. I need a treadmill. I need an exercise bike or something. I need to even tell my wife or my spouse that I want to be more physically active, so that if anytime I'm slacking, they'll be able to remind me that of my decision, and so forth. So they are preparing to make a change. And if possible, like just as we talked about physical activity readiness examination, they can even go and do medical checkups to be sure that they can do the physical activity without any problem. And then even for diabetic patients, if you are diagnosed to have diabetes, you can take your time and mourn, go and mourn, and that's why the stages of bereavement is there. The first one is denial, mourn, and then decide to fight the disease, and then you can even go and see a doctor with knowledge of diabetes control, who can be a specialist, who will now give you a package care, a personalized care. Will refer you to a dietitian to arrange your diet. It can refer you to an exercise physiologist or a physiotherapist to package your physical activity routine. And then, of course, the doctor that will regularly see you, that will see you on a regular basis, probably every quarter, and then the annual medicals. So these are preparation to change. And then the next stage is to making the change. This one is the D-Day. Starting from the D-Day, you will start to do your work, try to implement the action. If it is to stop smoking, now you have stopped smoking. Okay, you have stopped smoking, and all the problems, all the withdrawals are there. All the withdrawals are there. All the withdrawal symptoms, all the problems, all the devil telling you to change, telling you to go back to smoke, and etc. are all there. Then the maintenance stage is when you have to remain born again in spite of the temptations. Remain born again in spite of temptations. Remain born again in their maintenance stage. Perhaps you have to run away, flee from the devil. You're free from change your friends. Change your friends. If you used to smoke with them, go and look for others. Go and look for others. In fact, when it comes to smoking cessations and even alcohol, there are associations. Alcoholic Anonymous. Those are people that are battling how to change. They are association of those that have decided to stop drinking. And we have also Nicotine Anonymous. They are also there, helping people with that. Okay, helping people how to cope. And then if it is something like cigarettes, perhaps nicotine replacement therapy will be available for people so that the withdrawal symptoms will not be that much. Okay, when you battle, when you survive this stage, you go into the advocacy stage. This advocacy stage is when you have conquered all and you are beginning to reap the benefits. You reap the benefits. Okay, if you reap the benefits, probably if it is weight loss or physical activity, people will now begin. So if you go, they will see that their blood sugar is low, is normal. Your BP normal. And then some people will just say, you are looking trim and younger. You are looking trim and younger. In fact, I must say, so with that, you will go into advocacy. This stage, you will be a preacher. It will turn you into a preacher. You will be willing to give testimony. You'll be ready to give testimony of the advantages of doing this healthy life, of changing the healthy lifestyle. Okay, I must say that you can relapse. People relapse. People relapse. People relapse. And you can relapse and go back. It's almost like the snake and ladder game. You can relapse and even go to the contemplation stage. From the maintenance stage, you can relapse to contemplation. You can relapse to contemplation. So a lot of changes. Yeah. But the most important thing is for you to, when you fall, the most important thing is for you to rise again. Even Barack Obama was a smoker, but after many attempts, he was able to quit the habit. So it's not just you can relapse, but there's nothing shameful to try again until you are completely free. At times there are incentives. There are incentives to what some of these things. If you have incentives, like I have personal incentives. I come from a family with we have a family history of hypertension. In fact, my maternal grandfather died of stroke, and then my elder brother died from slumped and died, and so nothing. So there is no greater incentive to do the right things, to do the more physically active, do all the things. And right now, my blood pressure is normal. In fact, if not that I'm a doctor, I could have said I have been cured. But my blood pressure has been normal. So there are benefits. So which means that I am at the advocacy stage. I'm talking about those things. But as I said, people can relapse. But if they relapse, they should also go back. They should also continue to go back. Okay. So these are the communication theories will help you package the message. Right? But when you package the message, you have to pre-test the message before it goes, before you can publicize it. Because messages, although you can design a message with the best intention, only for it to be misinterpreted, only for it to be misinterpreted. Look at this. Look at this. This is the 200 naira note. How you look at this? In recent times, this illustration has now been reinterpreted. Originally, when it was first used in the 200 naira note, it was just to deplete the agricultural produce of Nigeria. But now, right now, with the farmer headers crisis, they said, so that even in 200 naira notes, the farmers' crops, are made available to be eaten by the cattle. The cattle. So that is one of those things you have to, when you design a program, when you design a message, you have to make them appropriate. Make them appropriate. If you are using, you have to observe some religious rules. If you are creating a poster of women, you have to, the woman should be wearing hijab, or the appropriate head covering in the Muslim north, and in the south it can be less. You can use other illustrations. So all these ones, these things we have to. So in the packaging the program, you are also using other means. You are using other means. You are using. You look at in packaging the program. We are also, you can use what they call the social marketing method. And in social marketing, they are interested in the price, the product, the promotion, and the place. So in packaging your health education, the price is not just money. The price is the trade and barter. If you change the behavior to another, remember in the health belief model, we talk about persons engaging in trade cost benefit analysis. Before we make a decision, we usually look at the cost benefit analysis. So that is what is called price. You are trading one behavior with the other. Look at in Nigeria, if you are obese, people associate obesity with affluence in Nigeria. But we know that obesity is a disease. So for you to convince somebody to lose weight, you should be able to convince the person to trade being seen as affluent to being lean. Lean. And if you are lean, if you are slim, if you have a normal weight, perhaps people will think that the economy is very, very hard on you. So those are some of those things. So the price is not just money, but a lot of other things. The product, you have to make the products good enough. You have to make the product good enough. You should be able to promote it in a good way. Appeals. Remember, we were talking about the consequences, and we talked about what you will say to a Nigerian man to make him act. Talk about his potency, and he will obey. And for a woman, if you tell a woman that that problem can lead to infertility, the woman will just run. Okay, and then you can say it in everywhere to make sure that all these things are done. Okay, I don't know if there are questions or comments. Comments on what we have said. Questions, comments. Okay. Well, leader. Hello, ma.
Hello, Prof.
Yes.
Thank you, sir, for the lecture. Please, listen to the stages of the trans-theoretical model of behavior change. And I want to ask, can it be used in some of our research studies in this public health? And also, I looked at the stages. I noticed that when you were describing them, there was one preparing for to change and making the change. So I want to be sure that it replaced the preparation stage and the other one replaced the action stage because you didn't use it the way you listed it.
Okay,
And thirdly, I
I was trying
wanted
to
to ask,
paraphrase. Yeah.
okay, I wanted to ask, for these stages, are there pertinent or maybe certain public health interventions that a public health practitioner can be able to put into place to make sure that the patient or the client can
Yeah.
transit smoothly from one of these
Yeah.
stage to the other?
Yeah. In fact, that is what the health education does. And that is one of the reasons why the audience, you do a formative research to understand the audience. Because the stage, you have to make it appropriate. If it's during the pre-contemplation stage, they don't have knowledge, so you have to provide the knowledge. The contemplation stage, they have the knowledge, but they don't have the means of making the change. So you have to tell them begin to tell them how to make the change or where to find help. So at the preparation to change, they have already found help, but right now they are being given prescription of what to do. Prescription of what to do. Like if for physical activity, you need one or two things to do, including that physical activity readiness examination. And then even for those that want to make stop smoking, things like the nicotine replacement therapy, nicotine gum, patches, lozenges, and etc. You have to identify them. You have to keep them ready. You have to keep them there. Then making the change. In this case now, the person has decided to take that step. The person has decided to take that step, to make that change. And in making that change, that is where the withdrawal symptoms for addictive products like smoking and even weight loss, because weight loss, you are likely to change your diet, and then you are going, the main thing is to reduce your calories. So which means that the person will feel hungry. So the thing there is that you have to tell the patient, you have to identify the problems the person is likely to encounter, and then find solution to them. The maintenance stage is when the immediate period or after the initial period. And this stage temptations, the person is getting used to, but it's not completely free. The person is completely free. At times, the person once in a while runs into temptation, and then the person should be able to resist the temptation. And then you have to also tell the person, tell them what to do to resist the temptation. At times for religious people, you can look at there is usually an inner mind caused by the withdrawal symptoms that will tell you to go back, go and smoke, go and secretly smoke. So you have to tell them what to do to counter it. What to do to counter it. Just like Jesus did, said, depart from me, Satan. Depart from me, Satan. Because that the inner mind was just telling him, oh God, you will soon starve to death. Why not just command this stone to become a loaf of bread? So this that maintenance stage is a stage where people face temptation. And then the advocacy is when they have conquered all, and then they can now tell people how they were able to do it. Okay? And then they can even go to the church and give testimony, or they must to give testimony. Okay? Okay, I just hope that is that. Emusere. Hello, I hope it seems I didn't pronounce this well. So pardon me. So just if it sounds like your name, you unmute and say something. Yes.
Okay.
Hello.
Good evening,
Go
Prof.
on.
Good evening.
Good day.
Yes. So, thank you for the lecture. I just want to clarify, in the stages of behavioral change, when you were talking about relapse, you mentioned that someone can relapse to the preconception stage.
No. It will be difficult because
Uh-huh.
if you know, no, but it can be the contemplation.
Yes.
Yes, but it is difficult to relapse to
To
not being
preconception.
aware. Not being
Exactly.
aware.
Exactly.
Yeah.
Yes.
Yes.
That's just what I wanted to clarify.
Yes.
Right.
Hello,
Thank you.
Elizabeth. Hello, Enang. Okay, probably
Good
struggling to,
evening,
yes.
Prof.
Yeah, good evening.
Thank you for the lecture. I just wanted to point out that it's been um, insightful, and so I want to ask. So, in selling this thing to these people, so would you now, because you want them to buy it, tell them something that is not true, or you have to make it look sweet, like
No,
social marketing?
okay, anyway, no. Okay, no. If you sell something with untrue, that is not true, it's not going to last. Because when they find out, they get angry with you. The only thing is that you have to give full disclosure. And that's why we are saying that if you tell somebody to stop smoking, you have to tell the person about the withdrawal symptoms. And then tell the person that, don't worry, we are going to do something. We are going to give you something to cope. So that is the thing. So you have to full disclosure. That is the best thing, and not to hide anything. Not to hide anything. Yeah. Okay. Yeah. If you want to succeed, for you to succeed in anything, you have to be sure. That's why research is always very important. For you to know what is best, for you to identify the side effects, and then tell the people about the side effects. Okay. Cyril. Hello, Cyril.
Yes, sir. Good evening, sir. Thank you very much, sir, for your lecture. Sir, just a confirmation, sir. I want to find out, following the series of changing model, behavioral changes model, the advocacy stage, is it also possible for the individual to relapse?
But it's anyway. I don't know. Relapse can be at most stages. But at the advocacy, you already know about the advantages.
Yes.
You already know about the advantages. But the relaxation may be probably if you find yourself in a different situation.
Okay.
For example, if somebody is used to jogging and the person is imprisoned, then it becomes very difficult. It becomes very difficult. Or there was one guy, they call him Jimmy Fix. they said he was even the one that popularized this jogging and running in the US. But he died. He slumped and died. He slumped and died. So, which means that like when if we usually we will be told that physical activity, blood pressure will come down, diabetes will be controlled, and all those things. And people just do physical activity and die and become Samuel Oparaji or Mark Vivian Foy. Or the one that the 3SC coach that died recently.
Yes, sir.
So those are the things that even if you have been talking, you have been preaching, going over all over, you begin to give doubt. Yeah, doubt will begin to creep in.
Okay.
So anything, somebody can relapse.
Okay. Thank you very much, sir.
Yeah. Okay. Okay. So let's anyway. Let's just take this one. This one has to do with. Anyway, we talked about this smoking cessation. Like we do a lot. This behavioral change we mostly use in these non-communicable diseases. Non-communicable diseases. So let's talk about these smoking cessation programs. We have talked about them. Smoking has a lot. It's associated, contains over 4,000 harmful chemicals. 4,000 harmful chemicals, and has been associated with a lot of adverse health effects. In fact, the WHO estimates that cigarette smoking is responsible for the death of close to 5 million persons every year in the world, constituting close to 9% of all deaths. So close to 9% of all deaths in the world are attributed to smoking. So there is every reason for people to smoke and not to stop smoking. So it is also estimated that smoking reduces the lifespan of an average male smoker in the US by up to 13 years. Up to 13 years. Average smoker loses at least about 13 years in the US. So, it's not just deaths. It is also associated with cancers of every part of the body, lung disease, cardiovascular diseases, etc. And it's not just deaths. It also causes some morbidities. For example, it ages the smoker. The smoker ages at a faster rate, which means that his biological age is much, much older than his chronological age. Biological age is the wear and tear. It's a measure of the wear and tear of the body, while the chronological age is measured in years. If you smoke, the wear and tear of your body will be much, 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 much higher than your chronological age. And then, of course, it causes blindness. And then in Nigeria, it can also cause impotency in males, and infertility in females. Impotency in men, and infertility in women. And then, of course, children are also affected, and children, even unborn children, are also affected because babies born to pregnant to female smokers, they weigh less and they die. They die suddenly, what they call the sudden infant death syndrome. So, which means that a child can sleep at night healthy and wake up dead. And this sudden infant death syndrome, a high proportion of them have been attributed to smoking. And then, of course, there are advantages. Almost immediately after, 20 minutes after, the blood pressure drops. Blood pressure drops. Within 12 hours, the carbon monoxide level drops. And then after 3 months, about 3 months, the blood circulation in the lungs improves. Um, within 9 months, the cough and shortness of breath decreases. After 1 year, the risk of heart attack, coronary heart disease decreases by half, and 5 years, the risk of stroke is reduced to that of non-smoker. 10 years, the risk of death from lung cancer is halved. 15 years, the risk of coronary heart disease becomes the same as that of a non-smoker. So, but in spite of these advantages, it's hard. It's hard to quit smoking. And this difficulty is mostly due to nicotine. Nicotine is a drug naturally found in tobacco. It is highly addictive. In fact, it's said to be as addictive as cocaine. In fact, some tobacco companies or cigarette companies have actually been accused of adding extra nicotine in the cigarette to make them more addictive, Okay, so yeah. So when somebody smokes, the brain gets used to the nicotine, and when it is cut off, the person begins to have both physical and mental symptoms: headache, tiredness, appetite, increased appetite. Some people use smoking to suppress their appetite, because smoking suppresses appetite. Then mental symptoms including dizziness and depression, frustration, impatience, anger are all the symptoms associated with quitting smoking. So smoking cessation program is a packaged program. In fact, in developed countries, you have such. Hospitals run smoking cessation programs. Not only hospitals, people through them can run smoking cessation programs as a private business. In fact, if you know enough, you can start. And these smoking cessation programs usually have 3 components: a counseling section, access to a support group, and nicotine replacement therapy. For counseling sections, can be physical, can be online. But they are all designed to convince the patient, to convince the smoker that he can do it. And help the smoker with providing support, people who will support the smoker to go through the processes. Okay, it can be face-to-face, it can be telephone counseling, and right now it can be virtual, it can be Zoom, so that you can provide this counseling without the patient leaving. In fact, the Zoom and other virtual platforms provides a good opportunity. In fact, if you run it virtually, it is even better, because your client base will be much wider than those that can come physically to come to your place. Okay. Then the second one is the access to support group, those that will help the patient, the smoker, to provide to the smoker to turn for encouragement, for useful tips and the rest. And these support groups usually made up of the counselors of the smoking cessation program. Usually there is a helpline. Usually they also have they also include family members, friends and co-workers, cheerleaders, those that will be encouraging the patient, the smoker, to drop the habits, put pressure on them. At home, the spouse and the children are involved, because you have to make a commitment to them. At the workplace, friends in the workplace should be there to help them, to help them. Yes, and most importantly, there are also groups like the Nicotine Anonymous. Nicotine Anonymous is almost like a group of people that have stopped smoking. They are similar to Alcoholic Anonymous, and those ones are beginning to set up like a church, like a church or a mosque, trying to help each other, offering social support to each other. Okay, so these ones, yeah, well, we have talked about this. Then the third aspect is the nicotine replacement therapy. Nicotine is what makes it more difficult for smokers to quit smoking. Nicotine is what makes smoking difficult to quit. Okay, so one of the best ways of dealing with the withdrawal symptoms is to make nicotine replacement therapy available to the patients. Nicotine replacement therapy available to the patient. This provides nicotine in a form that is different from cigarettes, and they include nicotine patches, nicotine gum, nicotine nasal spray, nicotine inhalers, and nicotine lozenges. These are available. These are used to supply to give to give the smoker nicotine instead of smoking cigarettes. So these things can be used. The patches is like a plaster, but they are usually placed on areas of the body without much hair, like below the neck and above the wrist, and then the upper arm or the chest. Then you have they are of different strengths. They are of different strengths. You have the full strength, and then you have the low strength, depending on that person's depending on the length and how dependent the person is. How dependent the person is. Then you have the gum. The gum is like, of course, there's chewing gum, but they are not. Yes, chewing gum. Yes, when you see some coaches, football coaches, when they chew, they are they are chewing nicotine gum because smoking has been banned. Smoking has been banned. Smoking has been banned. So when you see a lot of people train, especially coaches train frantically during games, know that is because they are chewing nicotine gum. Then nasal spray. They spray it into the nose, and nicotine will be absorbed through that. Then inhaler. Inhaler. Examples are e-cigarettes. E-cigarettes. They are like cigarettes, but they delivered just the nicotine. And then lozenges like sweets, like sweets. Then there are at a point the patient is then weaned off the use of the nicotine. After some time, the person is gradually weaned off using Zoban, and other drugs. Ziban and other drugs. Okay, so we have done this. I don't know, questions, comments, smoking cessation, questions, comments. Hello, Cyril.
Okay, thank you very much, sir, for your lecture. So just a clarity. Earlier on the course of smoking cessation, I think I heard that nicotine is one of the addictive factor while
Yes.
people who smokes. And in terms of trying to withdraw people from smoking, we are also giving a nicotine. Is it that this one is a subtle dose or what? And how does it work, sir?
No. The thing is that nicotine is addictive. So when they stop, the body will begin to, there are lots of inconveniences, headache, irritability, a lot of things. Some of those things can push the smoker into relapse. Yeah, into relapse. So that's why the nicotine replacement therapy is given to supply the body with nicotine and prevent those side relapses. But it is the use of nicotine is better than smoking because it's not just nicotine that goes into the body. You have 4,000 other chemicals, including smoke, including smoke that go into the body and cause trouble. Okay, so that is it. But if you give, but since nicotine is addictive, you want to begin to you will supply the ex-smoker with nicotine replacement therapy until a point you begin to reduce it so that the body gradually gets used to not requiring nicotine for full action. Okay, I hope I explained that. Hello, Oluchi.
Good evening, Prof.
Good evening.
Thank you very much for your lecture. So, I want to ask concerning the nicotine replacement therapy, what are the side effects?
Yes, all the side effects of use of nicotine, like of course, the heart will beat, the blood pressure can even increase. The blood pressure can even increase, and depending on how you use it, like if you are using the spray, it can cause nasal irritation, running nose, throat irritation, and etc. The nicotine gum is exactly not sweet. It has a bad taste. It irritates the throat, and of course, it causes increased heartbeat and so forth.
So at a point the patient experiences all these side effects, and it's not yet time to wean off the patient. So as a public health physician or someone undergoing the smoking cessation program, so how do you help the patient in case of to reduce withdrawal symptoms?
You reduce it slowly. Like now, if you look at these steps, you see step 1, they were using 21 milligram. Step 2, you can reduce to 14. Step 3, you can reduce to 7.
7 milligrams.
Yes, and then you can tamper. And of course, you have different patches, like all these, they have different strengths. So they keep reducing until they get back.
Thank you, sir.
Yeah. Okay. Hello, Juan. Juan? Hello?
Maybe I ask question.
Yes.
Hello.
Yes.
Hello.
Yes.
Hi, Prof, can you hear me?
Yes.
Okay, good evening, Prof. Thank you for the lecture. I just want to ask, I don't know if taking shisha and vape, if shisha has contained nicotine, because I know I've had people that are trying to withdraw from cigarettes, and they say they are replacing it with shisha and vape. Vape is proven. Is it advisable?
Yeah. Those ones are also form because are also form of getting into the lungs and getting absorbed. But the problem with cigarettes is because of the other compounds. But these other ones, you can control what you add. You can control what you add to those things. So they are not as toxic as cigarettes. Yeah. Okay. Hello, Ebele. Ebele Meto.
Good evening, sir. Thank
Good
you
evening.
very much for the insightful lecture. Please, I just wanted to ask, so for those who have been smokers for a very long time, like a very long period in their life, because I know that sometimes, like, there are people that try, like, I have a relation, he's in his 70s, but he has not been able to break off his habit of smoking. Is there anything that can be done for them? Because he has done all this counseling, support group, using maybe lesser, maybe less dangerous alternatives, but maybe after like a month, 2 months max, he's back to square one.
So it should keep trying. You know that it happens just as we were talking about stages of behavioral change. You can even those that get to the top, after some time they can relapse. It happened to Barack Obama. I don't know if he has even gone back to smoking. Yes, so it's
Okay,
there.
okay, sir.
But the other thing too is perhaps you should also. I don't know if he has also tried the nicotine replacement therapy.
I think he tried it, but he couldn't keep up. He even tried, like, there was some time when they had this, is it electronic? I don't know how they call it,
Yes,
cigarette
that
or so. He tried it.
e-cigarettes,
And
yeah.
sometimes when you ask him, you say, please leave me alone. One thing must kill a man.
Yes, so
And he smokes till date.
yes, yeah. At times it's actually that's why it's addictive. That's why it's addictive, and yes. But the thing
Okay.
that just as I told you, my personal experience, those my senior cousins, it was the black suit of Port Harcourt that killed them, and they died within two months of each other. They were both of them were in the mortuary together. Imagine. Yes. Okay.
Thank you,
So
sir.
yes, thank you very much. I think this is where we'll draw the curtain for this week. Next week we'll continue. And I'm going to get my other colleagues to come and give the lectures they have missed. Lectures they have missed. So thank you very much. We are going to end here today. Let me also use the opportunity to thank you people for your understanding. It was the conference was becoming a hard sell. But thank you for all those that put in words for us. We run this school, we try. There are a lot of criticisms, but we try to live. We try to act on areas we have been criticized, but we want to also give them reasons why they shouldn't criticize us. So the standards, we try to increase the standard so that we will not be found wanting. And the other thing too is that once you get a certificate from a school that is well regarded, it opens the door. It opens the door, except you want to use a certificate as a chieftaincy title. But if you want to use it for practice or some other things, it's better you get it from a reputable place. And the good thing is that our graduates have actually done well, including those that went abroad. In fact, I don't know how she did it. I don't know how she did it. She did biomedical technology in Uniport. And then, although I think she made first class or something like that. But she registered in our program, did it, and after that, she's now in the US, and she was employed as an assistant lecturer somewhere in the US with her MPH. And we have other people. So, and it shows the strength. At times, it can be stressful. Can be stressful. But it's for good. It's for your own good. It's for your own good. Before it's for your own good. So you try. You try to also. Things are also very difficult and very expensive, and to do a lot of things very expensive. Yes. So thank you very much. Thank you for your understanding. And then also, if you don't have money, don't worry. Don't worry. Don't worry. You have till the end of your program to pay. The only thing is that before you collect your certificate, you have to show us evidence. And then those paying, please try to also have evidence, evidence of payment, so that if you are called upon, you'll be able to, you will show it, because it will be one of those things that will be checked before you be signed off to collect your certificate. So thank you very much. I think since what I've said has elicited two raised hands. Ihai. Hello, Ihai.
Good
Okay.
evening, Prof, sir.
Good evening.
Yes, sir. Prof, good evening, sir. Can you hear me, sir?
Yes.
Please, I'm very grateful for the wonderful lecture, but I just want to digress a little concerning our registration. The call that is coming from desk office concerning for online registration with 12,000 naira upload. I don't know why these officers should not upload my documents that are on my dashboard. Please, sir, help us beg them.
I just make it clearer to me. There are during the orientation we said there are two ways.
Yes.
If you upload your documents,
Yes, sir.
because we do this registration on behalf of our graduate school,
Yes.
they require the hard copies. So if you upload your documents, will they need to print it,
Yes, sir.
including your passport? And that's why they said you pay a
Yes,
certain
sir.
amount, 12,000. Once you pay that amount,
that's 12,000.
They will do it for you.
Yes, sir.
So if you are paid,
I've paid.
If you are
paid,
paid,
sir.
Are they still asking for you to make a further payment?
No, to submit, to send my documents to their WhatsApp.
No, I don't understand. No, you're supposed to upload
so that they
it
can
now.
print it that there's nothing on my file. I uploaded them. I showed them. I even gave a picture of the upload because on my dashboard, my page, it will show
all
the
right. It's all right. It's all right, Ihai. I'm going to. They have to go and look for it where you uploaded it, especially if you have paid. It's one of the reasons why we let them collect that amount. Don't worry.
She said,
don't worry, Ihai.
downloading.
Don't worry.
Thank you, sir.
Was it male or female? Ihai.
She refused to give her name.
Okay, but female.
My document. Yes, sir.
Okay, it's all right. Don't worry.
It's a female voice.
Okay, don't worry. Hello, Elizabeth. Hello, Anang.
Hello, Prof.
Yes.
Okay, thank you so much for the lecture. I want to ask regarding the conference. So people that would pay at the end of the lecture, would they also be allowed to be given access to the lecture?
No,
virtually?
you will. No, you will. In fact, because we have effectively converted it to a levy, so the links and everything will be provided, just like these are lectures. It's just that, so which means that we have assumed that we have paid either now or in future.
Okay, okay.
Okay.
Prof.
Hello, Udeme. You want to give us the
Yes,
closing remark?
good evening, Prof.
Good evening.
No. Good evening, Prof. So, Prof, please, I want to get clarification in case someone register and maybe has a paper to present. Is there a platform to do an online
Yeah.
presentation if the person is
Yes.
not
Yeah.
physical?
No. Do we expect you to
Okay.
come? We are not. If the refreshment is for few people now. Stay where you are. You will. Yes. Okay. You will have access to. You are supposed to. If you have an answer to present, you will send it to the advertised email. It will be reviewed, and before the conference, you'll be called upon because the presentation will be pre-recorded. So that we won't have problem of share a slide. Some people don't even know how to share slide. It will be pre-recorded, and then during the scientific section, people will be called upon. Pre-recorded presentation will be played, and then comments will be made. Okay. Thank you. Thank you very much. I think we can end here. Those of us that are football fans, I think it's time to start going to the stadium.
Yes.
Yes. Madam, what do you want to talk again now? You know, you want to make I miss the
No. Good evening,
The
sir.
match.
yes. Yes.
Good evening.
Yeah, good evening.
The email that you are to send proof of payment is said it cannot be found.
Which one? That is okay. Let me
SPH journals@unipo.edu.ng.
the email. Okay, proof of payment. Okay, you can send it to the WhatsApp.
Okay, sir.
Okay, thank you. Thank you very much, and have the best of the rest of the evening.
Thank you, Prof. Good night,
Yes.
Prof.
Good night. Good night.
Thank you, Prof.
Thank you,
Thank you,
Prof.
Prof.
Good night,
Good
Prof.
night. Have a nice
Prof.
sleep rest.
Good night, Prof.
Thank you, sir.
Bye, everyone.
Bye, everyone.
Thank you, Prof.
For
And good night. Thank you.
Thanks, Prof. Good night.